Computer. All right, so we're gonna be recording this as well, so we can replay it. And if anybody wants to listen to this recording, you can do that later on as well. So good evening, ladies and gentlemen. My name is Umer Khan. I am practicing here in Pennsylvania, and we have our esteemed guest, Dr. Ateeq Rehman. He is in the Marshfield Clinic Health Systems, and he is the residency program director for the internal medicine program. And how are you doing, Dr. Ateeq? How are you doing today?
Very well. Thank you so much. Assalamu alaikum.
Wa alaikum salam. So we have a good amount of people on this call, and initially we will be going over a few questions, more of a general nature to keep the discussion, to get the discussion started. And then we will go into your specific questions. So this video, we are going live, especially on Zoom. So please join us there. And the link is available on the AMCANA page, as well as the Geo Iqbalians page as well. So you can go over there and join this live chat if you want to ask questions, as well as you can put your questions on the AMCANA Facebook group. If you're part of that, you can put your comments in there as well. And I will look to get these questions addressed. All right. And I'm going to make this a speaker view, so the speaker is able to address directly with the people who are going to be benefiting from this. So let's start off, Dr. Ateeq. Now we're having virtual interviews. Do you have any tips for candidates, some general tips for candidates who are going to be doing this virtual interview, these post-COVID scenario?
So, excuse me, very commonly asked question for someone, I would say that they should appear more like you than me, because my lighting is not as good as yours, I guess. One of the tip of virtual interviews is you should be in well-lit place. Your eye level should be facing the computer, sort of similar things. If this is during daytime, and most of the interviews are, your windows should be open from the front, where you can actually, you should be facing window, so your clarity is more apparent. Rest of that is like your appearance, because you are in virtual realm, you should be more, you should appear more relaxed. People are not actually watching you in 3D, they are just looking at one view of you. So I would say that it matters that you are resting comfortably, you are not fidgety, you are very very much relaxed. You should try to breathe from belly, and your shoulders should be in relaxed posture, and just be yourself. Otherwise, I would say that compared to virtual interviews versus interviews in person, I think you are able to get a good assessment of the candidate. I was skeptical on my ability to judge a person when they are not sitting in front of me. But I would say, and it's very common now that, you know, program directors feel comfortable interviewing people virtually and getting a good idea about them.
All right. Actually, I was also talking to an individual yesterday, and he said, so basically a few tips just to carry over from what Dr. Ateeq is saying. Definitely have a light source in front of you. If it's sunlight outside, you can open the window. That's the best. Second thing is, your camera does not need to be great, but your audio needs to be good. If they can't hear you, then the video doesn't matter. So just make sure that your computer has a good enough mic that you're able to do so. And then the person was asking about, I believe, about the laptop being good or the camera being good. So if your laptop is a little old, but it can handle good live streams such as Zoom or Skype, then make sure that your camera is decent or your webcam is decent. If the camera on your laptop is not that great, it is very old, it is only, let's say, less than 1 MB, then maybe just get a webcam that has high def, full HD video, and that will serve your purpose. So video is okay, and your audio needs to be good. And then your background doesn't need to be great, it just does not need to be messy. Don't show people that, oh, you have junk at the back, or there's a bicycle parked at the back. So just make sure it's presentable. Your audio and your video are decent. Audio needs to be especially decent so that you can communicate effectively. Dr. Rehman, Dr. Ateeq, have you been seeing these issues with people?
I had one. I mean, I have seen a few. Of course, there are like In the interest of privacy, I would not disclose those. But sometimes people get distracted. They have not secured the place. Like for example, I'm right now in the process of talking to you. I mean, I try to tell my family not to come in this area, but the people's pets can walk in accidentally. Someone can come inside the house and they are communicating. But I would tell you that even if those incidents do happen, um, you are gracious enough. You just should ignore all of those things, because there is a human element in that. You cannot replace an in-person interview completely with virtual interview in terms of presence of a person, and some factors are not under their control. So it's very important that if your audio is not working, not to feel too bad about it to ruin your interview. Or you can, a good program is always going to give you another date. This happened to us like a couple of times. Someone was talking to us from Egypt, and their camera stream was not working, so we had to reschedule them for another date. But as you said, as even for the background, people are interested in you. You should look professional. You should dress professionally, without any. I mean, just be yourself. That would be the sum of it all.
Right. That's a very good point over there. One question that I just have been asked by Sarmad Pirzada, which I believe I should ask right now, is that when do programs stop reviewing new applications? I know you already got the applications. You went through a lot of applications. It's November now, and are we or programs still looking at new applications, or people should stop bothering calling programs at this current point that they've already called out their interviews already?
So that's a very good question, and that marker changes for every program from one point in time to another. If you have, like, for 10 positions, we get close to, like, I mean, we more than, like, 3,000 applications to read. If I say we do, it's very difficult to just find the time where you fill the slots and then you are looking for more. Now with the virtual platform, you hardly ever have a person who is canceling, compared to previous times when in-person interviews there were multiple cancellations because people could not make it. They had to have a lot of resolve to come to some of the programs, and which involved expensive travel and stuff. So our rate of cancellation, and so is true for many others, is, like, that has decreased. So if the program has lined up candidates and interview is starting, from that point on, the ability of I mean, the possibility that they are going to extend you an interview, it all depends on how many uh, seats they have kept. So for me, for example, like, there would be 1 year in which we would, by between September 15 and September 25th, all faculty are available. We scan through applications and we choose 90-95%. There are years when we are working, or, like, the faculty who are going to be in search and who are going to discuss who we are going to interview, they're going to be busy. So the process can go till mid-October or early November. Also depends on when you start, when the program starts interviewing. They are starting in early November. By end of October, they will have most of their candidates lined up. So I cannot actually answer that question. It even was not true every year for my program. So I would imagine that it would be different for different programs. One day you suddenly have an opening, and you look at your emails and you find, like, a good candidate, and you can choose that person or send that person for review as well. So it depends on there are many factors which determine that.
Got it. Excellent. Yeah, there's so many factors involved and so many implications. I think I'm going to go over one more question that somebody asked me previously, and that was about filters. And that question comes in, especially if the scores are not that great. So, do programs have a filter? And what is an average filter? You don't have to tell me your filter that your program has, possibly below which you don't accept you don't ask people to come for interviews. Is there a filter, and what could low score people do if there are filters, and what can low score people do possibly?
There is again a moving target. There was a time when we used to apply filters very heavily, and we would find people with scores, and then you would filter them out. Comes a time when there is score inflation to the point that you don't that and after experiencing firsthand working with residents, you understand that scores don't mean everything. And so I would say that many programs apply filter. That's their way of uh, singling people out for, and every program director and every faculty would differ in that. I would say that my personal experience with applying filters change with every passing year. uh, there is actually a work group in AAIM. I'm a member of that. They are American Academic Association of Internal Medicine, where they are one of the work group is going to work on filters and what type of filters we choose. They are going to diversify filters, but even now filters can be applied. There was a time when we applied filters. Now we just look at, like, sometimes we do apply filter for certain group, like for example geography is very important for us. People who are living and who are actually have addresses which are in Wisconsin, they would be very important candidates for us. So that filter would become important. But scores as a filter, I don't know, people feel like they're filtered out because of scores. People are filtered out. I mean, there are many ways. When you contact a program, when you send a good email, chances are that someone at some point during their recruitment are gonna see your email and scan through it. If they if that email does not have scores, they may assume that the scores are low. I mean, that's one thing. But if the scores are if your scores are decent and you sent out an email expressing your interest in that particular program, chances are that someone is going to definitely get log into Eras and they're going to review your application. And then it depends on, like, I would say a lot of this is luck. Like, I mean, people, not scores don't matter. I think sometimes very high scores are a handicap. Look at very high score and someone selling you very high score, you just put them on a side. Like, your very high scores, you should probably go to, like, a university program or some program that can like, or you just feel like, these scores are very important to you, so you should go to a place which values that much score a lot. So the difference between 240, 250, 260, 270, I mean, like, if you decipher it in terms of how the clinical practice of person is going to be, even how they're going to do an in training exam, there is a wide variation in all of that. So I would say that, programs do apply filter. Yes, some programs will send, and it depends on geography. Like, which program are you talking about? There are programs which even don't go in errors. They filter out candidates. They find, like, people with highest scores, ask them to come, and they are out of the match. They would ask them to sign pre-matches. That's an age-old thing. But I would say that application of filters varies very, very widely from one program to another.
Right. So viewers, what basically Dr. Ateeq is saying is that every program is different. And sometimes you need an insider to figure out, okay, which program does it which way. So if you feel you're a good candidate for a program, you should contact them, you should email them. And sometimes I recommend people that hey, pick up the phone and call the coordinator that, hey, my name is this, and I believe I'm a good candidate for your program. I may have lower scores, but I believe I have other qualities and experiences that will make me a good candidate for your program. So I've encouraged people to, just call the coordinator, and maybe they look at their profile, as Dr. Ateeq is saying, and you may be lucky that, okay, something opens up and you may be called in for an interview.
Umar, one thing which I would say that only call coordinator if you know that coordinator is responding to you. Many of these programs are actually, there is application inflation every year. So there are so many people that coordinators, if they start, and this was one of the questions that was you mentioned that, when do the programs tell that we are considering or not considering. Now, for programs, it's a major issue. If, like, there was one time where we sent everyone that you are not gonna be, like, we are not gonna be considering you. and then your email box is filled with responses in case you get an opportunity, then another one, like, did you get another opportunity? So the program's response and the coordinator's response is all, again, as you mentioned in the previous question, is program specific. If you know someone in the program, like residents, for example, if the residents are gonna forward someone's application, I would say that, most program directors, I mean, I would honor someone, one of my residents sending me an application, I would never throw it. I would just make sure I review their profile, RS application in detail before it. There might be programs which are too big where the residents, like, they do not consider recommendation from a resident, but there are programs who would only consider recommendation from resident if you've physically been present around them, you have worked together, you have clinically worked with them. So that varies widely, but I would say that if you randomly start calling every coordinator, you will randomly almost always go to a voicemail that is less likely to be heard. Who knows? Like, every program varies.
All right, scratch my recommendation then. Okay. All right,
I just extended the options on that, and
right.
yeah, diversified
No,
options.
gotta be straightforward, and you have to use your time wisely. You have to use your time wisely because right, your time as well as the coordinator's time is important. Your time is also important. Okay, um, so I think Shandana Yunus, I think that answers your question. I believe letters of interest, that if they already sent out that they're not going to be interviewing more people, then I think it's done at that point. We'll get into a few interview questions a little further. And one question I want Dr. Ateeq to answer, if he may, what are you looking for? Are you looking at the person's presentation, the person's communication skills as an interviewer? What are you looking for in the person? What do you want from the person in that interview? What do you want to gain from that person?
So I would say you look at uh, you look at a person and you are talking to a person, you make an opinion about them in a short period of time. We always do that when we meet someone, we have a discussion, we try to understand what is depth of their personality, how they act, how they interact, how are they communicating, what are their likings and dislikings. So this 15 to 20 minutes of interview is about that. Now there is no, of course, there is no extra. I would not. I would say that, being a program director, I've been wrong many times in understanding a person during the interview session, and with experience, what you're looking for also changes. For example, like, I mean, at one point you are really interested in extroverts who just come out there and they have very strong personality, and then you switch gears and you, based on your experience, now you're looking for introverts who are more sound in their mind. When they talk, they have more substance, and for sometimes you feel like, someone is extremely quiet, and that is something that, that you almost feel like, I mean, no one should be extremely quiet during the interview. But I would say that it's like the whole personality, whole component. So I would say, if you are a normal person, that's what I would say, that the secret recipe of success during interview is be yourself. Be yourself. I can easily understand what you are going to say next if you prepare that interview with someone. What is your area of improvement? Before even telling your area of improvement, you would say, this is my plan of working on it. This is my plan of improvement. This is how I am going to work on that. You're going to become overly defensive so that the other person on the other side is not gonna take an offense. So you all those games, as we start and we end them, all those answers, those are like, I would say, be yourself. I would say, if someone is like, if someone has a script about their role models, for example, someone's role model is their dad or is their mom. That is true for people in subcontinent, and like, I mean, in I have seen that, we are, I mean, based on my background too. But you should back it up with good substance rather than a statement which you have gone through over and over again. I think any program director is good at understanding how good, I mean, how much time you spend preparing your answers for the interview. If you have, if you are pausing, if you are taking your time to answer the question, if you take a 3-second pause, you are thinking, and you are really thinking, and the answer comes out, that's where you can make so much gain that the whole preparation of interview cannot get you, because someone is looking at you and trying to see that you are a thinker. And if you communicate well, if you be yourself, I think you're going to do the best when you are sitting in front of anyone.
These are golden tips that you're providing. I think these are golden tips you're providing, that be yourself, try to be as natural as possible, right? You have to prepare for your questions, but try to be as natural and present as a human, because a physician is a moving person, a moving individual, a personality who has to deal with different situations. And if he's able to take care of an interview and be natural, be calm, collective, then that is really helpful. And I think you touched on a couple of interview questions here as well, so that is excellent. So one question, I think it's a very common question, and possibly the introductory question that people ask in an interview. And Aisha Anwar is asking this question: how should we answer? What are you looking for? Tell me about yourself. Just a basic question. What are we looking for? I know different people look for different things, but what are you looking for? What are you looking for personally when you ask this question?
Yeah, I ask this question all the time, but I think it's in so many ways it's an unfair question, because tell me about yourself can be a whole life story of a person, cannot end in 2 hours, while it can end in a couple of minutes. But I think for tell me about yourself question, and again it is such an open-ended question that it is like, I mean, most of the times when the reason that they ask this question is ability of a person to articulate properly, ability of a person to give an account of themselves. It should not have a starting and a perfect ending. That's all I can tell you. If you are gonna say, like, if you are gonna start like a parrot, and you are gonna go all the way from beginning to an end, that it is a script, and sometimes you see almost poetic references in that. That is what how it should not be answered. I think any answer which goes for like a couple of minutes is fine. And you can say, I think I might have left out few things. I would be very happy to answer questions. And I think, oh, this was not probably all of what I wanted to cover, but I'm open to any questions, saying the name. So for example, Dr. Rahman, this is about me. This is what I could say about me. But I mean, you can ask me any question. I would be very happy to answer any further questions about me if you have those specific questions. So I think that's my response to this particular question. Again, hard to answer, but in order to for tackling with it, like, I would suggest, like, I mean, again, program directors vary from one, I mean, like, they vary widely, but I would say that you should not, if you are extremely terrible in grammar, in spoken English, you can try to imitate that a little bit. But I would say that still, if you just be natural and be yourself, and someone says, like, someone sitting in a drawing room setting, an elder asks you, tell me about yourself, kid, where are you, what do you do? So what are you going to tell them? Think about that, and be relaxed when you're answering. Have a smile on your face. Don't end in, like, 20 seconds. Just have a little bit of an account. And it's okay if you're going to switch gear. It's okay to say, excuse me, my train of thought went wrong. I wanted to mention that, I went to med school and in this year, and then I joined this particular area, and then I moved forward. So that's how you answer that question.
Right. Just to throw a little bit of extension on what Dr. Ateeq just said, just be natural, be yourself, be composed. You could have a structured answer. But don't make it sound like it's computerized. So be natural, be easygoing. As a person, okay, I know you have my information, you know where I graduated from, but I would like to state a few things regarding my background. I do feel, before I say all of that, that I am a very dedicated, hardworking person. I put all my emphasis on what I am doing, and I believe medicine as my forte and my life moving forward. and I'm looking at the opportunity of pursuing at your place, but I graduated here and I did this in medicine, I did this house job, or et cetera, et cetera. And then I did this research position, et cetera, et cetera. And now I'm here in my next chapter of my life. And like Dr. Ateeq just said, that I don't think I can do service to my life on this short session here, but I would love to talk further if you have any questions. Something like that, maybe.
Well said.
All right,
You are hired.
so am I getting the residency or no? Okay, so okay, let's see. What's the next questions? What is the highest scores? I think you already mentioned about the higher scores and the lowest score. So as per your program, you may not necessarily look at the higher score or the lower score, but of course, scores do matter a lot.
Yes, very much.
Yeah, but it depends on the person and the experiences that you look at your program. So I'm going to go over to the next.
Been actually historically there has been score inflation. So every year the scores that we are seeing, they're better than the prior years, and there are actually studies which prove that. It's not, they have compared to, like, two 20s of today is what two 40s and two high 240s was of like 1990. So it's very important for you guys to understand that scores do matter, and if you have lower score in one particular step, for example, and it's going to become more important once with the next matches when you will have only step 2 score available. I think it's very important to take another step and do better in that. That's your statement that you can do it better. For example, someone has two 10s, two 15s, for example, in step 1 and 2, and they take step 3 and they have 225 or 230. That improves their chances of getting an interview call. Filters or no, you just have to do a little bit of, like, again, like, using emails, using your links, getting to know residents in program, for them to see your application, especially if they're applying filters. But I would say that scores do matter.
Right. Maybe I missed your answer, but if somebody has a failure, let's say in a step 1 or step 2, is that a sure shot, difficult match for that individual, at least with your experience?
I would say it's very difficult for me to say, to answer that question, and it varies. Like, for example, the goalposts keep on changing, as I said, but it's extremely difficult, I would say, for programs these days to hire people with attempt, when you have so many who have very high scores. People go unmatched in with very decent scores these days. As I said, there is application inflation. You can have, so why you take risk in the program? That's what programs think about when they are looking at applications. So I would never say to anyone that, just like, it's not worth it. Don't try because you have low scores, and you have or you have an attempt. But I would say that attempt it becomes a real problem. It's just, yeah, it's
Right. No, I agree. I was contacted recently by an individual with 2 attempts on step 2, but she eventually passed. I said you should look for non-medical, medical, but other things other than residency in the US possibly. So I'm going to go over questions quickly. We have loads of questions coming in. As a program director, okay, somebody's asking about, as a program director, what are some good or interesting questions that candidates have asked you, or candidates ask questions which are not appropriate? So yeah, that question, I think, let me rephrase it. Can a candidate be aggressive, or candidate be rude, or a question that is inappropriate? I'm not sure that happens much, but maybe you can quickly just talk on this quickly.
Yeah, I won't let anyone do that to me when I'm interviewing. So I think don't give an opportunity to anyone to become rude to you. Some people, some statements are like, for example, I mean, again, depends on an individual. For example, if someone says, I really like the color of your tie. I think in in-person interviews, those comments were more sort of, if a candidate says that. Those are like, in virtual interview, it kind of sounds a little bit odd to me. But I would say that, again, I don't take offense of that. Um, People do not ask any question which is like, I mean, the most one of my favorite residents actually who graduated asked me question, how can I be sitting on your seat in future? And by no means that was an offensive question. That was really good question. And I said, are you interested in my job? And then, like, I mean, there are, like, there is no question which I would say is offensive. Sometimes people say, I would give example that if the program director is an endocrinologist and they say, I don't like endocrinology because it does not, I don't feel enthusiastic about it, there is no much work in it, or there is no much trauma in it, I like more. I mean, I think you should avoid those statements that are, and again, most people do not take it to their heart, but it is a statement of how much control you have on your words when you are talking to another person. So those are, like, minor things. But again, I would never say that anyone has been, like, has said something which was offensive. Actually, you have to be very careful being a program director to make sure that you stay extremely professional when you are interacting with candidates. Most of them are anxious, most of them want to, it's very important for them, they appeared, and I have a lot of respect for them.
Right,
When they
excellent.
are.
So I've got a couple of questions coming in. I'm going to, at the end of this session, I'm going to share a couple of questions that you may ask to your faculty members. And I think you need to have a set of 5 questions. You need to have a set of 5 questions. I'm getting another call, sorry. Let me mute this somehow. You need to have a set of 5 questions at least to ask any faculty interview that you are involved in. So we'll talk about that, and Dr. Ateeq can discuss on that as well. Okay, I'm going to move quickly on this. Is there a supplemental ERAS application? Someone, do you know what is a supplemental ERAS application?
Yes.
I'm not aware.
Yes, the programs, you can choose a few programs on which you can be more elaborate, and you can get sort of a deeper dive of your interests, and those programs can download some applications in which there is more information about the candidate that they are interested in. Actually, I don't know beyond that because we did not participate. Our whole institution did not participate in supplemental application program. So I don't know any details beyond that. That it was like, it came across, we discussed it, and because we did not, I had like good information about it in the beginning when we were sorting it out, but we were told, I mean, we did not actually, as a program, we did not go into that, so we did not opt for it presently. So I don't have all the details about it.
Got it. Okay. So next question. Oh, it's a statement. This session has already lessened my anxiety. All right. Thank you. Yeah, it's all about being confident, all about being relaxed. So and putting your best foot forward and being confident. Okay. Next
If I
question.
could tell you, Umar, one second, if I could tell you one thing that you can take out of this session, if you like, if you remember that Kung Fu Panda uh, and magic recipe, what was the recipe? And it was you see your face in it. It's all about you and believing in yourself. And I think you would do much better on any given day if you believe in yourself, even with broken sentences, even with, unless you're terrible at spoken English, which you hardly ever see anyone that is. Be yourself, and I think you're going to do much better. Preparing them, someone is in front of you and says, let me do an interview. Even if you do that, don't do it like 200 times, and don't try to come up with the right responses, uh, because it's going to be very difficult for you to show that you did not prepare it all and do a good job. That's my opinion about it.
Excellent. Guys, I'm seeing there's a lot of interest, and we may not be able to get to all the questions, but I'm thinking, Dr. Ateeq, if you agree, we may hold a second session as well. We'll try to get this going for about an hour, and then we'll try to do maybe a second session some other time. Is that okay? Maybe some other time? Maybe we can ask some questions directly.
Definitely.
All right. Okay, excellent. So I'm going to try to move forward. What's the best, Sarmat Pirzada is asking, what's the best approach to answer ethical questions? So ethical questions, okay, that may be an interesting question. Ethical questions meaning I'm not really sure. Can you elaborate on that? Maybe Dr. Ateeq, you have an idea of ethical questions?
I don't know. I mean, ethical questions are the questions about your work ethic, or I don't know. He has to
Clarify that.
clarify that. For example, disputes with fellows, like how you are going to handle disputes with fellows. Yeah, I think you again be yourself. Like, how do you handle disputes? What's the answer to that? Most of these questions, sometimes you put a question just to understand what a person is thinking. Sometimes I would tell you, like, sometimes the interview goes all about someone's hobby and interest, and it starts and ends there. People have reviewed your applications. They know, they just want to make sure that you are a person who knows. Uh, yes. Or, there. I did understand your question. I'm sorry. Whenever I look at the screen, I just get distracted. So, your question about disputes with a fellow and how you are handle it, if it's related to patient care, just try to talk to any resident on how things work here. You want to maintain collegiality, but you have to report, or you have to take the next step for good patient care. That's like, that's like, so if someone is working with me as a resident and they see that I am doing something which is terrible, and I'm not, like, providing the right care, or, like, it's something that they should have a structure where they can report. That may be, like, the head of division of education, or someone on top of the program director. In similar ways, like, it's your moral responsibility to report it to appropriate person when you are clearly seeing that something bad is being done. And I think that is being taught everywhere. That's a part of when you go into an organization, you go through the HR, and you want to make sure that people are performing their job and nothing unethical is taking place. So I think you should just follow maybe the question, the person asking question wants to know how you would deal with that question based on US system. So make yourself aware of how that is done. I mean, that's a good question. You can ask someone like Umer or someone else who's practicing about how you should deal with that answer. And yeah.
Right. I think that's a very good response. Basically, what he's saying is that you will say that I believe that my goal in life is patient care. And if I feel that patient care is being compromised due to any reason, whether it be a colleague or a nursing staff or any other manner, I will look to escalate it in a proper manner based on the condition and based on the situation.
And of course,
Escalated.
you're not going to have rhetoric. You're not going to see that, guidelines says you have to give, like, heparin at this stage, and the person decides I'm going to wait for a couple of hours. You're not going to jump onto it and say, like, I mean, you are not following guidelines. So again, it's
It has to be
all
reasonable.
about the severity of the situation and your understanding. If you are an intern, you may not understand what's happening, and you may, like, you may not be able to even get it being an intern. But if you get it, like someone is walking in hospital drunk, for example, or in care area, you just have to report it, period. You cannot just keep it to yourself and say, I don't want to talk about it and all of that. You should report it to appropriate. So once you are sure someone gives you an example which is purely, like, right in front of you, unethical, you have to report it.
Right. Excellent. So a good question. Mehreen is asking, how should we mention about our weaknesses? Normally the question is, what are your 3 biggest weaknesses? And what do you think about this question? It's a very common question.
Ooh, so I would ask Marine what her weakness is. Like, I mean, honestly, like, I mean, this is like you are asking me, like, how should you answer? Like, how should I answer this question? And it comes back to similar Kung Fu Panda example of see yourself, see what your weakness is. If you don't have a weakness, say I don't have any weakness. If you and back it up with your argument. If you have any weakness, talk about that weakness openly, accept it. You say I mean, like, and I would say be natural about it, like, and say it all out rather than be defending it before even saying it completely. You don't need to, there are some things you don't need to defend. Like, I mean, everyone knows you are going to work on those. So you can say, like, you can talk about those, but people who are purely defensive, they have pads won all the times, and they are just trying to make sure they are just trying to come up with the best possible answer that one can easily judge. So talk about your weaknesses. Say, if someone asks me that question, maybe, like, I mean, honestly, like, I have many weaknesses. I'm not saying that should be the answer, but if you start thinking about it, like, that you can find so many. And I think, be humble about yourself, take it out, and say, like, people are gonna, your honesty and your transparency will be respected. It will not be seen as a sign of weakness.
Right. I think one aspect, this question can be very tricky. So people say that, okay, if you really give a big weakness, then the program director or the interviewer will say, the person will say that, okay, he's not good for this program. So what people think about this question is that they present a small weakness and they say they're working on this and they're trying to improve this, and this is how they go, and this is how they've overcome this in the past. Is this sort of a way we can approach it? If we say something like, oh, I can't memorize things, then that will be a big problem. Oh, okay, he's going to be a problem. He may not pass step 3 or something, or he's not going to pass the boards or whatever. But person, let me just repeat. Let me just change what was about to say. If I say that, okay, I have trouble memorizing things, but you can say that I believe that's a problem that I have, but I have overcome this problem over the years, and you can see my scores are good, and I've performed exceptionally well in most examinations, and I'm here talking in front of you, and I know how to study better now. I believe that I may not pick up things as quickly as somebody else, but based on my own experience, based on my own successes that I've had, I do fairly well in the long run. I don't know if that's
I would tell you this, that, again, I would say that interview is just one aspect of a person's personality. If you are interviewing someone if you extended a call to someone, you know that person is going to have strengths and weaknesses. Every program director, after hiring a resident, they struggle with one or two residents throughout their career during residency. So I would say that, I mean, definitely you should tell what you did to work on that. But I'm saying you should just be open about it. You should just answer it the way it actually happened to you. Or if you are still working on it, I would say, if you are still working on it, you cannot see a patient in 15 minutes. You're still working on it. I would respect the person who says, like, working on it but didn't reach there. I will eventually. I'm sure that, I've overcome many things in life. I will do this. But, like, I mean, spending 1 minute on weakness and then 15 minutes on, like, what am I doing for weakness? And even if before it comes out of your mouth that you have a weakness, you start defending how you are a superstar in dealing with all of that. That is something which I would say is, like, again, I would come back to the same point. Be yourself. People can understand you are. If you are telling that you had a weakness and you are the best role model for taking care of that, then you should back it up with, like, an award you received in that. Like, you had communication issues, you received an award on communication. Or, like, people got together and nominated you as a master communicator. I'm just giving you as an example. So I think you should not overdo these things. Don't overthink about these things. Be yourself.
Right, Joe. So humbly say a few weaknesses. Okay, I don't think I'm as fluent in speech as everybody else, but I think I do well. Say that's one weakness. Okay, I think I have to study a lot more than other people, but I do well. So don't keep on going into it. Just be casual and say, okay, I can still handle things. And you can say, okay, I may take a little longer to see patients, but I feel that's important for myself. That may be a weakness. Okay, fine. That's okay. I think that I'm okay with that. Be confident in yourself, maybe.
No, but you should not say that I'm okay with that. I'm not
Okay.
saying you should say I'm okay with that. I'm saying first, like, you should talk about your weakness, and then you should talk about how you are gonna, if that is your weakness, it should not be made up weakness. Just be yourself. Just
Right.
be yourself and tell what you have done. For example, like, what was your plan, or you came, if your weakness was taking more time to see the patients, what did you do? Did you put a stopwatch in front of you when you went in and you saw the time and you said, I'm gonna see the next chest pain patient in like 15 minutes or 20 minutes? What was your plan that you did? I mean, be natural, and you actually did that. Whatever you did should be the one that you should be responding. I'm not saying just say, yes, that is my weakness, and I don't care, or I don't want to do anything about it. I'm saying just being overprotective about your weakness even before you start talking about it is very cliche. It's like, you just know where this question is gonna go. This is one of the questions you would ask, and you are just gonna sort of, so you can think about other question, next question, and all of that. It should not come out like that, you just say, oh yeah, this is also gonna go on a certain path that this candidate is gonna take. It should be all natural answering.
Excellent. Excellent. Just be natural. Don't keep on talking about that weakness. Move on. Be natural and say what you have achieved, even with that weakness. Excellent. All right. So, how much does an interview count towards matching? Is it all interview performance or all factors? Do they rank after interview or near rank order deadline? A couple of questions here. So I think you probably answered this already, that interview does count a lot. If you flunk your interview, then maybe scores won't matter. Is that
So
what you?
yeah, definitely. If someone is a poor interviewer, you scores do not matter at all. If you have 270s and you are standing and you're just not, you're sitting in front of a person and you are not making sense. I'm not a representative of all program directors in US, but I would say that interviews do matter, and that's why we have interviews. So um, as far as populating the list, populating the rank order list, at what point you did, I think this is like, don't put extra burden on your mind. Your job is to find a, like, your job is get an interview call, do your best. There are so many factors in all of this, that this is like, this cannot be, actually, all of this process cannot be science. But I would say one thing about interviews. A person who is energetic, if you are an energetic person, if you are an energetic person, people view you, and they are always viewing you when they ask these questions about your interpersonal relationships, your response, the way you smile. They view you as if, like, one of the ways of looking at you is like, fitting you into that environment of the program. So you're walking around, you have your colleagues, how you interact with them, how you say hello to people, how you have a conversation with them. They try to get an idea of what would be the fit of a person in program. That's again, like, I mean, again, I would goes without saying that most of these responses cannot be extrapolated on all programs and all program directors. Everyone has a personality, everyone goes by their own train of thoughts, like, I mean, but I would say that, an energetic sounding person, the person who is going to bring positive energy, when you look at them, and if that is their personality, that creates a positive impact as well. So interview means a lot, yeah, to most of
Right.
the program.
Excellent. I think another point with this is you're trying to gauge if so you want the person to fit in with the crowd. You want a person that you can have a cup of tea with, or go to, or in the US, go to a bar with. I mean, not just metaphorically speaking. Somebody you can relate to, somebody you can talk to, somebody is receptive to your
Yes.
conversations. One thing I've noticed in the past is that interviewers pick up people who have microaggressions in them. Microaggressions mean that you bring out sarcastic statements when you're speaking.
Hmm.
So they look for people who may have these red flags in them, that they could be a little argumentative, or microaggressions. Maybe people can look up what are microaggressions and try to avoid those things. Microaggressions, try to avoid those things.
I said, like, I mean, naturally, as you are, I would say humility, and I think micro, again, you are able to pick those people who are, I mean, just talking about, I mean, if you are not smart enough to cover that aspect of your, this is what I would say, if you're not smart enough, no picture is perfect, no person is perfect, But in an interview session, if you cannot control your uh, your tongue to the point that you just come up with appropriate answer, stay away from being sarcastic on another specialty. Oh yeah, you know how surgeons feel. Oh, you know. I mean, no one is gonna take that with like, I mean, I personally don't like those answers where you talk down upon another specialty. You should never do that. So you should be smart enough not to do things which are outright uh, uh, offensive. And if you are not smart enough and you are doing it now when you are interviewing, you're definitely going to do that when you join the program as well. So yes, one thing that programs are good at, I think program directors are good at, is trying to find a person who is like, I mean, is making sure that they if the person is arrogant and they cannot even control that, that is like, they can be, that is like, one of the best interview filters, if you will, for a person like me.
Right. Excellent. All right. So just be yourself, be calm, be humble, be kind, be considerate when you are
Be
in the
yourself.
interview. Okay. So next, Sarmat Pirzada, example of disputes with fellows. I think we already addressed that. It has to be patient-centered. And of course, don't create an argument immediately. Try to not be the agitator. Try not to respond in an agitated manner. If somebody is doing something wrong, then you go to your superior and say this is happening. If it is a dispute that you can't handle among yourself, then go to your superior. I think that's what this question is asking. For example, disputes with fellows. I think that's what they're trying to ask. Okay, disputes regarding colleagues, regarding patient care. I think we already addressed that. Okay, another question about fellow not working properly. So if a senior or like a fellow or maybe an attending is not working properly, I think you would say that again, you try not to create an issue at that current point, but communicate it to the superior or the head of department possibly.
And I would say that a lot of these questions are again they are asked for the same reason. What is your ability? What is your emotional intelligence? How are you going to handle conflict? And I would say that most of you guys, like from the background that you are, or like, most of the people are not going to come up with the wrong answer to these questions. Just be, rather than getting perplexed about it or getting anxious or fidgety about it, answer it the way you feel that question should be answered. Again, if you can get one thing out of this particular session, just one thing out of this particular session, that can be a recipe of success, is be yourself. If you are not an antisocial person, if you are not a person who is able to deal with conflict, if you see a conflict and you, rather than sitting on the chair, you are going under the chair, then this is a problem for you. But if you know how to face realities of life, if you are, and most of you guys have reached this stage, you do know how to face reality. So just be yourself and answer the question in the best possible manner, or say, I'm not, I have no, I probably do not know how to handle that question. I will talk to my program director, and I would just confidentially go and say, I want to talk to your chief resident, and I would discuss the situation and ask them confidentially, what should I do in that situation? Again, very common, like, as you take the question, there cannot be an answer to a question. You guys are intelligent enough to know the question and answer it in the most honest manner that you can. And if you don't know an answer to the question, trust me, you should say, I don't know the answer to that question. Have I interviewed and I have said that? I have said it, I don't know answer to that question. Or I have said, like, I mean, I cannot do this. Honestly, this is my weakness. I cannot do that. And I still was able to have, like, very good interview. I'm just saying, throughout my life, as I appeared at various places and spoke to people. So again, be yourself.
Excellent, excellent. So just be yourself and take it easy. And if something is frustrating, something is really upsetting you in that interview, just say, okay, I don't know the answer to this question, and maybe I can think about it later. Next question: is there a downside to stating a future interest in a competitive fellowship, a gastroenterology, when asked by a PD about your post residency plans, especially at a community program? So I'll start off answering this question you need to research the program you're interviewing in. You need to know everything about that program. Where are the residents going? What fellowships are being offered? What services are in that hospital? You can have this question as a question to ask the faculty or the person who's asking you the question, but you should have a decent idea. And I would think that you don't respond with that, hey, I want to go into cardiology, when that program does not have cardiology fellowship in that program. Dr. Ateeq, what would you have to say for this question?
Again, I would say that, my program does not have a fellowship, but I have residents who joined us, and they are like, going into competitive fellowships every year. Uh, just be yourself. I mean, I understand the uphill task of getting into a residency, being a foreign medical graduate. I do understand that there is so much you have to do, but I cannot say that you should tailor make your question, your answer. That would be wrong for me to say that you should tailor make it according to the program that you are going to. If you have 20 papers of research in cardiology and you want to be a cardiologist and you got a call from a community program, you just have to tell them that you are a committed physician who will do community, who will be 100% true to program, but you are eventually going to do a cardiology fellowship. Because any program in US, you name it, the best or the worst, you will find people who go to competitive fellowships eventually from all kinds of programs. So they may see you as a, if you are a very competitive person and you want to go to cardiology and your CV speaks of that, and you ended up going into a community program, do you think, like, why won't they rank you? Why would they feel like, why would you feel like you won't be ranked? And if they don't rank you, then you are not a match for them. Just move on. I would say my response to that, like, if my son goes to Pakistan, does med school, and comes back here and he is applying, I would say to him, keeping in mind all the uphill struggle that we have, or you have, everything in mind, be yourself. If you are going to be yourself, you will not be defending yourself in question number 3 after that, or 4 after that. If someone says, oh, what about this GI research, or what about this GI interest, why did you spend time in this GI, with this particular GI person? I would say, like, the honesty, one lie, you have to defend one lie with, like, 4 or 5 lies. Be yourself. That's, but again, I would say, if you the it comes with a disclaimer. I'm telling you how I view things, and how my fellow colleagues, or my limited program directors that are friends with me, how they view things. This cannot be generalized for all the programs.
Right, but that's very important that you said that. If somebody has one goal in mind, they can say, I've been working for this, and in your program also I will continue to work for this in the future. I believe that I can attain this. And I've let's say, for example, as you just said, that your residents have gone into excellent fellowships after residency there, and you will know this information for that program, that I've seen
Yes.
that your graduates have been able to get into competitive fellowships after residency, even though this residency is not provided. But in case you have a fellowship in mind that is already available in the program, then you can of course speak about that as well, that yes, I want to do this fellowship. Okay, moving forward. Aliza Rafakat has a question. I have a visa related question. Suppose a program offers H1 and J1 visa both. Can you talk about wanting to be sponsored for H1, knowing that have taken or are going to take step 3?
So varies with one program versus another. We waited for some of some programs. I would not, like, I don't want to talk a lot about my program. Again, just keeping in mind the confidentialities and what we should talk about, but it varies from one program to another. If you have step 3 and the program sponsors, can I tell you one other thing that you can take from this? If you're stuck with J1, you are doing J1 research and you have no other option, then that's fine. But otherwise, my again, based on my experience, my limited experience when I was a resident, uh, or what I say to interview candidates when they talk to me is they should always try to go for H1. There is, if you can, and most of the programs would like to see your step 3. And starting next year and even this year, you see more and more of step 3s which are already there. So if your step 3 is there, people are gonna feel much more comfortable thinking, yes, this person can apply for an H1 and we can take them. But on a personal note, you should know that J1 is very, very difficult visa to live with actually. And it just, whatever your plans are, it really is very, has a lot of negative impact for that. Have step 3 ready. That's always the best uh, sort of like, way to go. Many programs will say up until December, you should have result. And some say up until January. Some wait up until March or even April to wait till they can offer you H1. So very, very few though. So most of them would like you to have H1 available if you are in, I mean, sorry, step 3 available with you.
All right, excellent. That is important. Step 3 is important. Another interesting question. Prem Shankar is asking, thank you, Dr. Rahman, Dr. Khan, for organizing this session. How should we answer if PD asks about visa choices during the interview?
Again, like I mean, I do not ask that question, and am not like, we know that someone is interested in J1 or H1, and I don't know what the agenda of program would be, like if they're looking for J1s or H1s. I don't know what their policies are. Some programs want more J1s or H1s. I'm not aware of all of that. I can talk about my program. Like, if we like a candidate, we we will sponsor them both kinds of visas.
Another question that I want to state here right now is, does participating in couples match reduce individual number of interviews? Do you prefer individuals who haven't applied to your program as a couple? I always thought that was a positive point of somebody, if both people have good standing in a couples match. What do you think about a couples match? I think that's a good question to ask.
It varies from one program director to another, one program to another. One, you sometimes you don't like. Um, so I would say how to answer that question. I think it varies from one program to another widely. But I think if you can get two which are going to be a good fit for program, as you mentioned, I think it makes you more of an attractive candidate. I think it would be, and especially like, if you are a husband and wife, for example, and if, or you are in couples, you're not in couples match, but one person gets a call and then you say, actually, this is like, we are sort of a couple match. I think I think that rather than that, it's better to be a couples match, because I think giving that kind of information makes you wonder, like, naturally would make any human wonder, like, I mean, want to be together, not a couples match, like, how much important is for them to be together, to be at the same place in the same program. Should we consider that, because they're not a part of couples match, but they know each other very well. So I would say that if you want to stay together, I think the best approach is couples match, unless there is a huge variation in score, and that again depends on how you want to handle that individually.
Right. If there's a big variation in score, maybe one person can pull somebody in, but I think in the interview, the person who has a low score will need to perform at least well in the interview. That say, hey, my scores were low, but I'm still a very capable person. I think in the interview, you need to do well if your score is imbalanced with the couple situation. Next,
So, Umar, just touching on that, there is, we have to stay within professional parameters whenever we look at these, and we try to stay like, if we are in couples match, we consider one, of course, we consider the other one very strongly. I think all of this is like, there is no, and it depends on the program's choice of how they are gonna consider the candidacy of one person versus another. So I would again say that, it's very difficult to answer that question completely in few sentences. Um, I just try to apply professional mind, have a big group in which faculty all discuss professionally how they should deal with that if there is that kind of situation, and we act accordingly. So yeah,
Got
so
it.
I'm just
Every
giving
situation
you.
is different. Um, so should we explain our strengths by giving examples of scenarios where we exhibited our strengths, or should we just mention it at points? I think you should be giving examples of, hey, okay, I do a really good job. Um, I mean, I'm a um, strong learner. I'm a very conceptual. You should probably give examples of that. I think you would agree with that, right? Probably.
Again, I think I would, yeah, I agree with that, that, just if you have a strength and you're talking about a real strength and someone says, give me an example of that. I mean, I'm saying sometimes it happens like that. Sometimes you give an example of that. Your answers should not take too much time answering. And one important message is look at the visual cues. You're talking to a person and look at what they are, how much engaged they are in your question, if in your answer. Actually, if they start looking away, or if they if you see that they are jumpy, restless, they want to ask another question, then if you keep going on that answer, or if you come up with too much lengthy answer, that is gonna be that is not a good skill of interview taking. So one of the skill of interview taking is understanding the visual cues of a person, when are they done with that answer, and when is it going too far. Yes, giving examples of strength is important, and giving again not being too much pompous about yourself, but giving good quality examples in which you, for example, someone says, tell me about your leadership skill. Say I was captain of swimming team, and I was assistant chief resident, and after that I was an administrator for hospital medicine. I was uh, like you know program director for NetBeats. Those are examples of real leadership that you had. Example of leadership is again, you should come up with good examples. Don't spend extremely large amount of time talking about yourself.
Right, exactly. Don't ramble on and just look at the interviewer and see they're getting tired or rolling their eyes or looking somewhere else. Make sure you stop that and let them continue. All right. I think we're extending our hour here. Are you okay in continuing a little bit?
I can.
Okay. All right. Um, all right. Okay. My question is by Dr. Misbah. My question is how often we should come with the clinical examples while answering our questions. Maybe this question is relating to tell me about an interesting case. That's normally a question that is asked. Clinical examples. Um, I think in general, anything you can support by a short clinical or your work related example, that's always good. But if your question is about a interesting question, interesting case that you had, and how did you handle it? Um, uh, yeah, you should prepare a couple of 2, 3 cases that you may want to
Yes.
present that you know about. I'm not sure if you ask it, but in the New York, Philadelphia area, this is a very common question. Tell me about an interesting case that you had.
Yeah, we used to ask that question a lot, and again, I say it's about moving goalposts, like how you approach a candidate, and once you realize that someone is, I would rather ask tell me about an interesting book you read. I mean, idle timer expired. Idle over time limit. Okay. Any key to continue this session? One second, I'm just trying to. Okay. So I would say that yes, have 2 or 3 cases ready. Again, don't go with all the. I mean,
आपकी वीडियो खत्म हो
just
गई है?
1 second. Let me see.
Okay, you're back. Okay,
Yes,
good.
yes. So don't. Yeah, think about those examples if they're asking you for. I remember I had a case of uh, parts fracture that I would talk about, and they would listen, and again, a lot of that is about your interest, how you articulate, how you talk about a case. Otherwise, it's not your And if I came up with a very interesting quest, if I saw a very interesting patient, that is not like, इसमें मेरा कोई कमाल नहीं है कि मैंने बहुत interesting patient देख लिया. It is about presenting it in a way that, that makes it interesting.
Right. Yeah. Yeah. You need to be able to present a case. This year-old man came in with this past medical history with a chief complaint of this, was very surprising. Then you have to know how to present a case. I think that's probably what they're looking to ask. If you know how to present a case, that's basically probably what it is. Okay. Is it okay to mention that you worked in a resource limited setting back in your home country? What would that show negativity? I think that would be a positivity. If you came from a resource limited setting, I think that would be a positivity. I don't know, you want to touch on this very briefly? I think that's a question we can answer very easily.
You should just be yourself, and you should just answer honestly, and that would be the best answer. If you are from a resource limited, if you are doing practice in a small village BHU, you were doing, you can win an interview by telling the details about that particular aspect of it, and if the questions are asked. So I think you just have to be yourself, and that way stay truthful, stay in the if you be honest, and you are gonna do the best. And what else is gonna make an interview better? I don't think so. Those people you meet and who say prepare the interview over and over again, they would they I'll tell you one important thing compared to that. One more important tip for interview question is answer the question after listening to it completely. See what someone is asking as a question. Hear what someone is asking. What are the answer? What do you need to answer? And if you are not sure about it, can you say, could you elaborate a little bit more on that? And then answer that question. Be yourself and be truthful. That's the way to go in an interview.
Excellent point. So if you did not understand the question fully, you can say, can you please repeat that question? I think that's a very important point.
Think about the one more thing, very important. If someone is not done asking question and you start right away, that is like, again, not a good interview skill. So 2 to 3 seconds pause is very good pause in a formal conversation before you answer the question. So, you should 2 to 3 second pause is important to gather your thoughts. How am I gonna respond, and how I'm gonna articulate my answer. Someone says to you, tell me about an interesting case you saw. So even though like, and you can say, like, I have been asked this question in previous interviews too. So this was an 80 years old male. So, but if there is a question like, what is the achievement you are most proud of? You just should gather your thoughts. And even if you are going to say, I'm most proud of my, like, the time when my son was born, or I got my first car, or I got admission into medical school. Think about how you are going to articulate that in a manner that is going to be natural, that is going to be truthful and honest, and you are able to articulate your thoughts. So 2 to 3 seconds pause is a good pause to gather your thought during the interview. That was again an interview tip, which was given in one of the AIM sessions, in which there were other program directors as well that I attended.
Excellent, excellent. Dr. Ateeq, do you want to stop it right here? We can reschedule. I think you may have things to do.
I would not. If I would say I don't have anything to do, that would be the wrong answer. Okay. But like, I mean, whichever way you want to do it, I'll be very happy to meet you guys again.
Okay. All right. We'll answer one last question, sure, and then we'll reschedule. Is that okay? I think what I'll do is, since people may have interviews coming up, we'll finish with this, asking questions to the faculty or the residents who are interviewing you, because this is a very common question at the end of any interview. So do you have any questions for me? This, I believe, is a very important segment of the interview. If your interview went well before this, this is an important segment. I normally suggest people that they ask open-ended questions, and some questions that are related with the person that is interviewing you. For example, what has been your greatest achievement in your role as a program director or in your role as a GI attending, what has been your greatest achievement as part of this residency program, and what do you see this, and how do you see this moving forward? I think that's a suitable question. Do you have any thoughts on this ending of interview situation? How do you see this?
You know, in all of this, Umar, I think you are doing much better job than like, than what I would do or I would say in terms of like, I mean, in my role as a program director, how can I tell people what they should ask? They're free minds. They should ask. I'm not preparing. I'm not preparing. I'm against the point of preparing people for interview. If they are interested in a program, they should do an in-depth study about that program. And if they want to ask, now that you asked this, you spoke about this, it's an extremely good question. I get it. Like, I liked it when someone asked me, like, what are the areas you want to improve in your program? No doubt, that's a safer question. But if you have deeper dive questions, you should ask them. So in my role as program director and one of the persons who interviews, again, anything which I would tell you which is gonna be tempering with the process of interview, I would not recommend. And I would say that, I would still say to you that going naturally with your style, coming up with a good question, you will come up with good questions if you did an in-depth study about a program. If that program be one of, if you are going to ask a question that someone already spoke to you in the morning about, I mean, someone says, this is our schedule, and you say to them, what is your outpatient clinic schedule? Is it 4+1 or not? That means you are not paying attention. So, you should, that is like, that is, even if you think that is a very good question, if you wrote 3 or 4 questions down and you are done with all of them because someone is covering all of those questions and you don't have any question, I mean, I would say that, I have seen program directors who say, this is weird that someone says, I don't have any question. But I have seen people that I thought were perfectly fine when they said, I had these questions about scheduling and this about your program. I learned everything about website. I don't have any other question. Like, anything you want to tell me, which is exciting about program, anything you want to tell me about your achievement. Those are like, very good questions that one can ask. So I would say that, I mean, maybe Umer can do a better job in preparing you for that question.
No, I think you just answered it, and I'm going to have Dr. Ghulam Abbas, he's the AMCANA president. He has his hands up, so I'm going to have him talk as well. I think you just said it. You just mentioned a very important question. What are the things you're excited about this program? I think that's a general open-ended question that you just told everybody. So that's good. That's very good. Dr. Ghulam Abbas, do you want a moment to talk?
Well, thank you so much. First, I want to say thank you to Dr. Ateeq and for your passion training young physician and taking your time. I know how busy schedule, when you are in academics, people have it, for joining us tonight. And I actually was sending messages. So Umer should not pull your legs more than 1 hour. So next time you should feel more comfortable in joining us. So thank you, Umer, for taking your time. And it was a very informative talk. And I think the part B will even help students more, especially people who are applying to, learn from all this process. So Dr. Ateeq is our celebrity. Thank you so much.
Thank you so much, man. Thank you. Thanks for all your good words and overly inflated words. But I would say that, um, just again, like, last message is be yourself. I'm happy to talk to you in as a group. There are, or everyone that I meet during interview or every application that I review tells, like, so much about a person and their struggle. And I have been in those shoes myself too. I think eventually it's a lot of that is like, how your struggle is. It's very difficult for a person to go to 1 or 2 programs of their choice. But again, overall, the whole thing is about just keep going on, be yourself, be honest, and you're going to do very, very well. Okay. So thank you. Thanks
All
a
right,
lot.
thank you so much. I think we will call it a day right now, and we will
Hold a
look
second.
to possibly schedule
Hold a second. Okay.
in
Okay.
definitely we will look to schedule in a later point. And please keep in touch with the AMCANA Facebook group and the Geo Iqbalians Facebook page or group. I think I don't know what that is, But yes, we will connect with you guys later. And if you have any questions, please share under the comments on the Facebook group so we can ask these questions in a later session. And hopefully we'll try to do another session possibly so that we can catch you before your interviews. Thank you so much. And thank you everybody for participating. Thank you so much.